Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalada, and my co-host today is Shanice Smith, licensed clinical social worker at Roots Community Health Center, and we are reporting for the week of March 15th, 2021. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we are here to cut through the noise and give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Please submit your questions in the comments, by direct message, or by email to admin@rootsclinic.org. Now, we know that even though the pandemic is worldwide, the effects are very different depending on where you are. So we're here to give you up-to-date information about Alameda County, Oakland, and East Oakland in particular. Alameda County now has over 82,000 COVID cases and 1,329 COVID deaths. Daily case rates and positivity rates continue to come down, which is a great thing, and is the reason why Alameda County has moved into the second worst tier, the red tier. That means that many things that were previously closed are now reopening. And as we know, with more mixing, that's more opportunities for exposure, which generally means increased cases. And remember, that is precisely what we've seen with the two significant reopenings and the subsequent spikes here in Alameda County so far. It is also worth noting that testing rates, so those that are choosing to get COVID tests, have come down so significantly that we are concerned about what we may be missing. As usual, the hardest hit areas are the least tested areas, which has been a concern throughout the pandemic. When we look at the past 28 days, the highest case rates are now in East Oakland's 94621, 94603, and 94601, as well as parts of Hayward and the Ashland Cherryland areas 94541 and 94544. These areas have case rates that are 4 to 5 times, let's say, the Montclair area of Oakland, 94611. Despite that, these areas continue to have the lowest testing rates. And you can see here that the zip codes are kind of flipped. The highest testing rates have the lowest case rates, and the highest case rates have the lowest testing rates. And if we are not detecting cases, that is how COVID continues to spread. So it really has been a vicious cycle for us throughout this pandemic, especially in these hardest hit areas. If you have not been vaccinated or you are partially vaccinated, remember that testing is one of the most important tools we have, both to keep you safe and also to keep others safe. It can not only help you identify it early and hopefully not spread it to others, but it can also help you get connected to treatment like monoclonal antibodies if you are eligible. And I'm posting the eligibility criteria here again because it's important to note, if you catch COVID and are at high risk of progressing to severe COVID or hospitalization, so you fall into one of these groups here, you should ask about monoclonal antibody therapy, as it is working to prevent hospitalization and progression in these groups. The treatment is not for when you are sick enough to go to the hospital, and you need to start it within 10 days of symptoms onset. So time really is of the essence. If you get exposed or get symptoms, get tested. And if you or someone you know contracts COVID and is in the high risk categories, please inquire about monoclonal antibody treatment. So again, if you believe you're exposed, get tested in 5 to 8 days. Now, if you get COVID symptoms, you should get tested right away, even if you are fully vaccinated. This is what the CDC recommends, and we agree that this is the prudent thing to do until we understand more about the vaccine's performance in terms of stopping transmission. And I'll talk more about that in a moment. So for now, the good news is case rates are continuing to come down, and we now have knowledge, information, and tools that, if applied properly, offer layers of protection that reduce the risk of COVID transmission and hopefully will help us see our way out of this pandemic. So the layers of protection we talk about, especially within our indoor environments, include ventilation, fresh air circulation, filtration, this could be on your HVAC or portable units, disinfection and sanitization, and that's of high touch and low touch surfaces, since all the droplets do settle somewhere, masking and spacing. And of course, if you are exposed or if you have symptoms, test and quarantine. Now, a very significant added layer of protection for an individual is, of course, the vaccine, which prevents severe illness and death. It is not yet a significant layer of protection for the community or the general population. We will need to wait for herd immunity for that. But the good news is that we now have 3 approved vaccines, which all prevent COVID death and hospitalizations. So a quick recap on the 3 vaccines. We have our mRNA vaccines, the Moderna and the Pfizer, and the Johnson & Johnson Janssen vaccine. They both target the spike protein. The Moderna and Pfizer do that through the code, the mRNA inside of a fat droplet, and the Johnson & Johnson is the DNA that is packaged inside of an inactivated adenovirus or the cold-causing virus. mRNA vaccines need 2 doses, 21 and 28 days apart for the Pfizer and Moderna, respectively, and Johnson & Johnson is just 1 dose. The most common after effects of fatigue and headache are much more common in the mRNA vaccine. So we're seeing less incidence of side effects with the Johnson & Johnson. All 3 of these vaccines are preventing death and hospitalization 100% of the time, which is truly remarkable. For severe disease and mild to moderate disease, these percentages vary a little bit, but I do want to caution us that these are not head-to-head comparisons. There was never a trial that compared these vaccines against one another. And in fact, these trials happened in different locations in the world. They happen in different time frames, and they happen in the presence of different variants or different strains of COVID. So these are not head-to-head comparisons, and essentially the bottom line of preventing hospitalization and death being 100% is remarkable and makes it such that these are all vaccines that are considered perfectly respectable in terms of protecting you and also helping to get us towards that herd immunity. Now, you are fully vaccinated 2 weeks after your second dose of mRNA and 2 weeks after that single dose on the Johnson & Johnson. So let's say you've gotten all your vaccine. What can you do now? Well, first, you can catch COVID-19 without dying. And that is a great and relieving thing. But it doesn't mean you can't catch COVID, and it also doesn't mean you can't spread COVID. And I'll talk more about that in a moment. Now, despite that, the CDC has put forth new guidance as it relates to fully vaccinated people. And again, that means 2 weeks have passed since receiving all of your vaccine. And I'm going to just say that some of what the CDC put out there does concern me, partly because of the message itself and partly because of the timing of the message. So what I think is most important here is that each of us have the information we need to be able to think through our own situations ourselves so that we can do our own risk-benefit analysis. So before I get to the CDC guidelines and my concerns with them, let's start with what we still do not know about COVID-19. So first, we really don't know who will do poorly with COVID. We know who's most likely to die, as about 80% of the deaths have been in those age 65 and older. But that leaves about 20%, more than 100,000 people in the United States who are under 65 and died from COVID-19. And it also includes a lot of people who are over 65 who did not die with COVID-19. And we were not able to accurately predict any of these outcomes. And aside from dying, we still can't quite predict who's going to end up extremely ill, who's going to end up in the ICU, and who's going to have long COVID. Over 2,000 children have gotten that severe life-threatening inflammatory condition, MIS-C, and we really do not understand why. There are also huge disparities for adults and even more for children, and we don't fully understand those disparities either. COVID has been highly unpredictable, with the potential to cause anything from very mild illness, and some people we would have thought would have gotten very sick, or it can wreak complete havoc on any and all organ systems and cause people to just crash, even people that we thought would do okay. Second, we do not know who is going to get long COVID or even how long COVID lasts. Some people with mild COVID cases actually end up with long-term symptoms or long COVID. This is concerning. And again, we don't know why this happens, and we still cannot predict who will get long COVID. There are also several things we don't know about the vaccines yet. How effective will they be against variants? We don't know. And if we fail to reach herd immunity before variants that escape the vaccine take hold, then we could be looking at a serious situation. So, stopping the spread does remain our first order of business. How long does COVID vaccine protection last? When will it start to wear off? Well, we don't know this yet either, although information keeps coming in. And right now we have about 6 months of data and it is still holding strong. So we can definitively say that it's lasting 6 months. And with every passing month, hopefully we can just tack on a month every time. But right now we just don't have that long term of data. So we can at least say 6 months, and we have no reason to believe that it is dropping off sharply after that. But again, we will need time in order to answer that question. And how well will COVID vaccines keep you from spreading COVID? We really don't know this for sure. There is growing evidence that the chances of spreading COVID after being vaccinated are far reduced, but we don't have clinical trials to prove this yet. This was simply not an endpoint used in the large clinical trials for the vaccines. So, why are we optimistic about this? I went into some detail about this last week, but in short, as we know, COVID transmission is primarily from having the SARS-CoV-2 virus in your airways and then expelling it out to others by coughing, sneezing, talking, etc. And we know that viruses get cleared from the nose and airways by different types of antibodies that actually go to our nasal mucosa and our airways. And the SARS-CoV-2 viral load in the nose is decreased significantly after you have antibodies against it. And we also know that vaccines prevent moderate and severe COVID. So even those that do get COVID after being fully vaccinated would have mild or no symptoms, meaning that they won't be coughing out large doses of the virus, meaning it will be harder for them to spread it. So all of that sounds very promising, but it is not conclusive. So, with all that we don't know, a highly unpredictable virus with incomplete information on the ability of vaccinated people to spread it, what can we do and what should we be cautious about? Well, the CDC has said that fully vaccinated people can visit with other fully vaccinated people indoors without wearing masks or physical distancing. And we can agree that fully vaccinated people should be able to gather unmasked in shared airspace if they do not plan to go around unvaccinated people without a mask on. Now, each one of these people, if they are not sheltering in, has a small chance of having COVID, even though they're vaccinated. That is what the data has told us. And they probably also have a small chance of spreading it. Again, that is not determined yet. So, should they then go around unvaccinated people? Well, if they could have COVID and if they could transmit COVID, then the most prudent thing to do would be to mask and distance from unvaccinated people. Now, if you live in a household with unvaccinated people and you are vaccinated, you still want to be careful around others, vaccinated and unvaccinated, because there's still the chance that you can carry and transmit COVID. Now, the CDC also says that you can visit with unvaccinated people from a single household who are at low risk for severe COVID-19 disease indoors without wearing masks or physical distancing. And I just have to say that I do not feel comfortable with this at all. The virus is too unpredictable to get comfortable with deciding that there are people who you are going to gather with who are low risk and that you will know just who they are. You don't know the medical history of everyone you go around. And as we've said, this is unpredictable and we just don't know who's going to do poorly. So I do not see any reason to say that unvaccinated people should feel comfortable sharing air, not masking and not distancing any more now than they were before. There are many of you who have been sheltering in as much as you can, and if you continue to do that, then your risk when gathering with others is still far reduced. So if you have friends or family members who are mostly sheltered, and you are mostly sheltered, and you are all vaccinated, then the risk is very low to all of those vaccinated people. However, when any of you begin mixing in public, or when you mix multiple households, you should consider that vaccinated or not, you were potentially exposed and could potentially carry the virus and therefore potentially spread it to others. You won't be so worried about yourself because you were vaccinated. But again, you were potentially exposed and could potentially spread it to others. So if you want to then go around unvaccinated people without a mask on, it may be prudent for you to get tested or isolate first. Probably simpler, wear a mask and distance around unvaccinated people. Now, again, if you live in the household with unvaccinated people, then the reverse is probably wisest. Continue to mask and distance when you are around all other people because you don't want to bring the virus home and spread it to unvaccinated individuals in your home. Your vaccination protects you. It may protect others, but we don't know how well yet. When we get to herd immunity, then we can say that the vaccinated are protecting the unvaccinated on a population level. But until then, we can really only definitively say that your vaccine protects you. Now, we have grandparents who've gotten vaccinated and are asking, can I hug my unvaccinated grandkids or children from a different household? Is that okay? Yes, we think that is okay. We think that is therapeutic even. But we still recommend wearing a mask, keeping good ventilation, practicing hand hygiene, and sanitizing your surfaces. We think it's best to be cautious not to mix too much until we can feel more certain about how well the vaccine prevents transmission, until we know more about the presence of variants among us, and until we know more about how long the vaccine protection lasts. But we can absolutely have the peace of mind that those who've been vaccinated are no longer at risk of dying from COVID-19, which is a major relief for most everyone we've talked to has chosen to get the vaccine. And it's a relief for those children and grandchildren who are worried about harming their parents and grandparents and relatives and elders. So now, when we're keeping the mask on, it's actually for the unvaccinated person. But whether you choose to get the vaccine or not, we know that this has been a difficult year for the vast majority of everyone in the world, really. So I'm pleased to introduce you to Shani Smith, licensed clinical social worker, to talk to you about pandemic stress, isolation, and coping.
Thank you for that, Dr. Noha. Hello, my name is Shani Smith, and as Dr. Noha mentioned, I am a licensed clinical social worker at Roots, and I work in the role as the Behavioral Health Program Administrator. Today, I will discuss the stressors that have been caused by the pandemic and the isolation that we have all had to endure in the last year and during these few months of 2021. I'm sure we have all dealt with unique stressors during this time, but some things have been a collective experience that has impacted many people, like unemployment, change in job structure, financial issues, children being out of schools and daycares, being around family members 24/7, not being able to enjoy going out and socializing, being physically away from friends and family for an extended period of time. For some, they've had to go through the holidays alone. There's been a distress over just the virus in general, but also in trying to differentiate between fact and rumors when it came to the information about COVID. So there's so many things. I could sit here for this entire segment and run off a list of stressors that came from the pandemic. We also know, due to the inactivity, isolation, physical distancing, being sheltered in place with people who might not be in the healthiest state of mind, a lot of mental health issues started to increase. More people started dealing with depression and anxiety. We know that intimate partner violence increased, and so did substance use. A lot of people realize that this is one of the first times where they had to sit with their thoughts and feelings with little to no distractions. And that's not always easy. It's not comfortable and it's not really fun. I'm sure you're wondering, how does one cope with these newfound stressors, feelings of anxiety, and feelings of depression? I'm here to give some insight and strategies on what you can do to decrease these feelings, whether it's stress, anxiety, tension, depression. So, one, be intentional about your self care. Yes, this sounds easy enough and it's been said 1,000 times, but you have to be intentional about scheduling time to do things that make you feel good. Whether that is a walk outside in the middle of the day, taking time to read something other than the news, taking a long shower, whatever that might be, make sure you plan it and you do it and do something every day. Two, make a plan for things you can control and practice letting go everything else. There are so many things out of our control when it comes to this virus, and that alone can cause many of us to feel stressed, anxious. So, what can you control? You can control if you take the vaccine or not. You can control your space and your behaviors. You can control how much information you take in and where you get it from. If you're working remotely, you have more control over your day. The things we can't control, knowing when this is going to end. We can't control if others get vaccinated or not. We can't control whether people wear their mask or not. If the government will provide more support to people and companies who are in financial need, we can't control. So those things we have to learn to let go for our well-being and for our health. So again, the things you can control, make a plan. The things you can't control, let it go. Number three, hug if it's safe. I think we all, in our own way or another, took physical touch for granted until COVID, right? Now that many people are getting vaccinated and people are extending their bubble of people that they can be around, don't be afraid to hug one another, bump fists or elbows. Have some type of physical contact because it helps. It has physical and emotional benefits when we hug. And after a year of not seeing our parents or our grandparents or our siblings, we are all overdue for some physical touch. Number four, ask for help. Reach out to your trusted social circle or even a professional if you feel like things are becoming too heavy, too overwhelming, or you're feeling alone. Yes, we're all in this together, but it can still feel like a lonely journey when we're dealing with our unique stressors and when we've been inside and isolated from our loved ones and from our normal routine. If you find yourself feeling sad most days, more anxious than usual, easily frustrated, triggered by the smallest things, then it might be time to talk to someone. And honestly, sometimes just getting it off your chest helps. It also helps to hear that other people are feeling the same. And one conversation can be the difference between things escalating to a dangerous level or things being managed and getting through it in a healthy way. Five, if things escalate in the house in any way, it's time to go. Know that your safety and well-being is the priority. The safety of your children is priority. So if that means that you need to take a walk or take a drive, do that. If you feel like, hey, there's a lot of tension in the house, because stress can lead to tension, which can lead to arguments, which can thus lead to violence. So if you feel like you need a timeout, if you feel like you need some space, take that space and take that time. We all aren't privileged to be able to move to another place or go live and stay with friends or family. So sometimes it's just taking a walk for a few minutes or an hour or driving around and just letting ourselves cool down and the tension to decrease before we return back to the household. Number six is sometimes we want to sit with the feeling and feel all the feels and sit with our thoughts, and that's fine, but we don't want to drown in it. So for some of us, this year has been enlightening. Honestly, sitting down and feeling the feels and really processing our thoughts has given us clarity and also helped us with some healing. But for some of us, it's been torture. And if you're in the latter group where it's been total torture, that's okay and that's normal. Again, sitting with the field and the thoughts and processing and feeling everything is not always normal. We don't do that. We're so used to our lives going and being distracted by work and picking up our kids from school and going to soccer practice and doing the dishes and cleaning and all those things that usually by the end of the day, we're too tired to sit and process our feelings and thoughts. But now, since we've been inside for almost a year, or basically a year, and we've been sitting with our feelings and our thoughts, sometimes it can be overkill and it can be too much. These are the times where you just got to get up and get out of your head, right? So you need to be doing something productive, whether that is, again, exercise, going outside, socializing in a socially responsible way, doing something that you enjoy, again, going back to that self-care. Sometimes that's okay. You can journal. Sometimes getting the thoughts out on writing can help. Again, just talking to someone, maybe doing a little rant or a vent, just getting it out of your head can be helpful because As we know, an idle mind is the devil's playground, and we do not have time for that. If you need any more help or any more coping skills or strategies, please reach out to the clinicians at Roots. That is why we're there, to help, to be with you so that you're not alone and that you don't feel alone. We can definitely just have one conversation if you want, or just call and just ask for some more strategies or coping skills. We're there to help. Anyways, that's my segment. My name is Shanice again. I appreciate you guys for giving me this time. Now back to Dr. Noha. Thank you.
Thank you for that, Shanice. And now here's our best advice one more time. We are making progress, but we think it's wisest to take baby steps here. Think of what is most important to you and how to do it in the safest way possible. Remember, the vaccine is only one layer of protection, and it is only protection for you, at least until we get to herd immunity. Mask, distance, increase ventilation in any indoor space, ensure proper filtration of recirculated air. In the absence of windows or central air, procure a portable HEPA air filtration unit appropriate for your room size. Don't share your air. Shelter indoors as much as you can, whenever you can, but only with members of your household. Mask up, space out, protect your elders and those with underlying conditions. If you think you were exposed and you are unvaccinated, don't go to work, don't gather, isolate yourself, get tested in 5 to 8 days. If you have symptoms, get tested right away, whether or not you are vaccinated. Continue to isolate until you get your results. If you are positive and in a high-risk category, please inquire about monoclonal antibody treatment. Take a multivitamin supplement and consider additional vitamin D supplementation. That concludes today's People's Health Briefing. Thank you for joining us. Please tune in next Tuesday at 10 a.m. See you then.